push me. I'm always looking for the latest and greatest. I got to come, I think at the beginning of the COVID thing at, where was that, Maurice? That was at the Queen's Buffet.
Oh, yes. Yes, when Benson teamed up with the other clubs and had the people come in during the COVID. Yeah, that big one.
Yeah, that was really good. So I met a lot of you there. But today I'm gonna talk a little bit about my organization. I promise not to kill you with PowerPoints and stuff for too long. Let me just switch the screen real quick. All right, so that's me. So we call it HIVAIDS for short. It's such a mouthful, Hawaii Island HIV/AIDS Foundation. But we have 2 locations. So I'm coming to you live from the top of the penthouse here at Hilo Lagoon. And we also have our Kona office at Palani Court, which most people don't know unless you say it's behind Taco Bell. So right behind Taco Bell is our other office. The history of our foundation, it started in the 80s under 2 different organizations. So it was Big Island AIDS Project in Hilo and West Hawaii AIDS Foundation. And so they, I guess when they first started, the main thing was that people were just dying of HIV and AIDS. And so the full purpose was just to help people survive AIDS, even if you could get the medications. Just trying to live with the stigma and shame of having HIV was really, really difficult. We've had people just drop their family members off at the foundation and say, you take care of them. You leave them at the hospital all by themselves. And that's how it was for a really long time. And a big purpose of what the foundation started for was, you know, dying with dignity, even without family or having friends. And so in 2003, both agencies merged to become Hawaii Island HIV/AIDS Foundation. It became island-wide. We are registered 501c3 nonprofit corporation. There's about 20 of us, 20 employees, and we operate on about a $2 million budget. So the mission of our foundation now is dedicating to assisting those being affected by HIV and AIDS and maximizing their quality of life, and to ending the spread of HIV. So before, there wasn't even that prevention message. It was just trying to take care of people that had HIV because it was a death sentence. But because of all the work that we've done, we're utilizing those lessons learned to help care and advocate for others against other related diseases. So hepatitis C, STIs, and so forth. And with our vision, we really envision the Big Island will become a place where new HIV infections and other related health issues are rare. And when they do occur, every person, regardless of all circumstance, will have access to high quality, life-extending care, free from stigma and discrimination. And that's something that we really hold dear to us. So how we have progressed from the beginning of where we started. Let me just back up. I know sometimes it is confusing, you hear it all the time, but HIV is the actual virus, and that leads to AIDS. And so HIV attacks the very thing that protects us. So we all know that with COVID around, but even the keyboards that you're touching and the mouse or mice, they do have viruses and bacteria all on top of them that are attacking us all the time. And so with HIV, it actually turns our immune cells into factories of virus, and we're no longer protected against those things. So people with AIDS die of these secondary diseases that we never really see, like toxoplasmosis, or these black plaques in the brain that come from you know, wild pig or cats, that living with cats, all of these strange little diseases. When you got a diagnosis of HIV, I think the survival rate was probably around 3%. So a lot of people passed away of AIDS. It wasn't until 1993 that these life-saving drugs came out, and they were like a mixed cocktail of things that people could take, and they were actually waking up out of their hospital beds and walking out of the hospital when we all thought they would pass away. And so,
Peter, if I may interrupt you, your screen isn't coming through all the way for some reason. It's partially cut off. The left side of it is cut off.
okay, is it, let me see. Let me reshare. Did it do that from the beginning?
It didn't do that the last time.
Okay.
Just this time for some reason.
All right. And it's still the same?
Yeah.
Okay. I'm going to stop sharing and reshare.
Okay. Sorry. I just figured it'd be helpful if we could see the whole thing.
Yeah, no worries. Okay. Let's do this again. Thanks. Thanks for bearing with me, guys.
Yeah, no worries. Yeah, we went through and checked it all out and had it all down. Yeah, for some reason, when you do that, yeah.
Still the same?
Yeah, it's still cutting it off.
Okay. Let me try this.
Even if you run through like that, we can see the whole thing, you know?
Yeah.
You just want to like click on each one.
Okay, yeah.
That would be fine.
All right, great.
Okay, cool. Thank you. Sorry.
Oh, no problem. So we definitely progressed. We now have HIV prevention and testing. So we have a rapid test where you can find out your HIV status in a minute. It's a quick little drop of blood, and within a minute, you can find out your status. And the good thing about it, if you do find out that you do have HIV, you can live a very long and productive lifestyle. It's more akin to living with diabetes now than a death sentence, which is really awesome. Also for passing HIV, we have this thing called pre-exposure prophylaxis. So that's called PrEP. So PrEP is a medication that you can take, and if you take it consistently, it's virtually impossible for you to get HIV. So there's something called post-exposure. So say you got a needle stick, you're working at the hospital, you push the trash down, you got a needle stick, you don't know if it's HIV or not, you can go on PEP, where if you're doing it within 72 hours, as long as you go on the medication for 4 weeks, you will not get HIV. One of the big things that we've also learned is U equals U. So U is, if you have an undetectable virus in your blood, you are not able to transmit it. So if you have HIV and you are on your medications consistently, and the medication, when you run your blood, it shows no virus in your blood, there is no way that you can pass it on. And what happens is that HIV is still stuck in your bone marrow, but it's not processing through your body through all the other ways that are there. So we really have a lot of great ways to protect each other from the spread of HIV. So you can see the finger stick over here, U equals U, condoms are still great, and then our PEP and PrEP. So knowing all of that, why do we still have HIV and why is it still spreading? Well, because there's huge challenges and barriers that are still out there. For our island, we do not have a big variety of HIV providers. So if you have HIV, our case manager really have a hard time trying to get you linked to a doctor. When it comes to PrEP, if you're trying to protect yourself from getting HIV, a lot of people are scared to talk to their doctors about it because some doctors can be like, well, can be very judgmental about things that happen. Not all doctors, but certainly people get scared bringing up the subject, especially with a doctor that they grew up with. There's also transphobia in the in medical care, we've heard a lot from our transgender patients that when they get to medical clinics or hospitals, the staff don't really know what to do with them. They sort of just, they dance around the issue. Also for STDs, which is a lot more common, there are no walk-in clinics on the island. Again, the stigma of HIV keeps people from accessing things. There's a large population of hepatitis C. People live with hepatitis C on our island. And as you know, the doctors are retiring, especially if you get to a gastroenterologist, two are retiring. And then we have our standard barriers that we all know of in living on the Big Island, which is transportation. We have a high incarceration rate. We have a lot of people that are underinsured and uninsured. And then for our agency, you know, it's very grant-based. So we're relying on the grants from the government in order for us to continue the work that we do. And so since I've come in working with my team, and a lot of work that has also been done for us, we've really tried to diversify what we do. So we have a lot of different programs that fall under HIVAIDS. And so one of the big things is, so we have hired on Kyle, who's on this call. He is our provider. So he's able to prescribe PrEP. He's able to see people that are on, that do have HIV. He is able to do transgender health, which can involve a lot of complicated hormonal processes. So it's what we're trying to do is to really address all of those barriers that we have on the island by trying to take it on and do it ourselves. So that is really fallen under our sexual health clinic, which we're starting. We also have a huge grant from MedQuest. So MedQuest has nothing to do with HIV. In November 1st, we have our staff that are going out doing open enrollment. I mean, with COVID, it's gonna look different, but we're trying to get the most people and the most fragile people signed up. So our Micronesian communities, those that are incarcerated, our farm workers on the MacNut farms, coffee farms, making sure that they get Quest insurance, so it's not putting such a huge, huge burden on our medical community. We also do Native Hawaiian social justice. We have a grant from Robert Wood's Foundation, and that's been going great, working with young Hawaiian men and also with Hawaiian women with our Brother and Sister Project. We also have a Syringe Exchange program on the Kona side. It's the first in our state that is a fixed site, so people can come that have a dirty needle, they can turn it in for a clean needle. It's 1 for 1. We do not give out syringes. And I think last month we exchanged about 13,000 syringes out of our office. So that keeps 13,000 syringes out of our parks, out of the public. It's making sure that people don't pass on hepatitis C. It's a really, really interesting program. And you'd be amazed at the community that's out there that I didn't even know until I started with IHAF. So like I was talking about, we do have our medical insurance program. It's called Kokua Services Partnership. We partner with YMCA Hilo, West Hawaii Community Health Center, and Kalani Hale in South Kona, and that's with our Quest program. So sorry, that was a lot of stuff in this one. Do you guys have any questions before I move on? Okay.
I'll save my questions for the end. If there's anybody else, I have everyone muted, so just write them in the chat.
I have some questions too, and I'll save them to the end.
Okay, great. One of the things we do is we outreach to our LGBT community. As you know, they're very overrepresented in burden of HIV, right? So this community, we try to reach out to as much as we can. It hasn't been as big as it hasn't been as big like as it was in the past. Now it's even greater, is what I'm trying to say. So for the Hilo Pride, we have COVID going on, right? So the Pride committee was really cool. They decided to do a drive-through Pride. And so you would start at the beginning at the county building, you would order your food, and then you'd pass through all the different tents. So we had our huge tent over there, and we would pass out condoms, we would pass out our flyers for MedQuest. Then they would also get to see a little drag show, a little razzle dazzle. There's a picture of my mom in the car going through. But at the end, you would end up with a plate of food. So I thought it was very, very creative as to how they did it. It's similar to the graduations that we did for our island, right? Nobody could get out, everybody stays in their cars, but everybody gets the information that they need. One of the big things that happened when I came in was it is a fresh set of eyes, right? So when I first came in, we were $100,000 in the hole, you know, morale was not good, equipment was failing. One of the big examples was like the office chairs. I don't know if you can see this in the picture, but I mean, there's like stains in the office chairs. It was very subpar in my opinion. So we got the money to get new office chairs just to start out, right? So I got new office chairs, but you can't even see the carpet. The carpet's like falling apart. It's got stains on it from before. So that's something that I'm looking for to help with our office and changing things and upgrading things. The amazing part of our agency is really our staff. Our staff has huge heart and they really, really know the clientele well. And so they get out there and they see the people. On the left-hand side over here, we got a 2-year lease from Servco. So we go take food out to our HIV positive patients in Ocean View or Kohala. Our needle exchange persons as well. We have a great person on staff that's always on Facebook trying to educate people about condoms or HIV or STDs, all the different things that we do. Like I was saying about the floor, we had a carpet in our clinic floor, in our clinic room. So our staff got together, they YouTubed, I mean, this millennial generation, they're so awesome. They YouTubed how to put vinyl flooring and they got in there and did it. So the staff is really the heart of our agency. And so I really want to do the most I can for them because they are the heart of what drives everything. And so on the horizon, what we have for HIHAF is our strategic planning in October. I really plan on changing the name. I think HIHAF was good where it was, but the HIV and AIDS moniker, we're more than that now. I think it's also been a barrier for people to come in that had HIV or I'm going to the AIDS place. So we're really looking at a good name change, rebranding, getting that message out to the community. Like I said, we have open enrollment. Now we're developing our medical billing with Kyle so that we, instead of just relying on grants, we can bill insurance and we can also do this 340B program, which helps us save money from prescriptions. And so that can help us generate income because as you guys all know, during COVID, I mean, everybody needs money, everybody needs to fundraise. But it's gonna be very, very difficult. Everybody's going for the same dollars. In 2021, we're gonna have our Valentine's drag brunch. So you get to have brunch and drag queen performances during the show, which will be really interesting. Gay Pride Kona in 2020. And then also just trying to develop staff professionally. We have a lot of frontline staff that haven't had the opportunity to be in management positions or supervisory positions, really trying to fit people into positions that show off their talents. And we'll also be partnering with universities. So internship programs. We have Kyle's been working with a university in Seattle that will be sending one of their doctorates in nursing programs down here. So we're trying to do a lot of different things, diversify, get people excited about what we do, get the word out. And it's an exciting time for us. It's very scary with what's happening with COVID. We deal with an immune compromised community, but we're there. And, you know, we've closed the offices on Wednesdays and Fridays, but yet staff still keep coming so that they can do the work that needs to be done. So that is my big spiel. Thank you so much for your time, and thank you, Maurice, for having me. I'll just open it up for questions and comments.
Well, thank you very much, Peter. That was really awesome. I certainly have a bunch of questions, but I'd like to give the opportunity for anyone else first.
I'll go, Peter. I just wanted to ask you about what is the Native Hawaiian Social Justice Program? Can you talk a little bit about that?
Yes, so with Robert Woods Johnson Foundation, they gave us a grant to develop this program that helps the Native Hawaiian individuals that are at high risk for STDs, for HIV. And so we developed this program called Brother Project, where it's 5 sessions, and it's same thing with SISTA, which is our women's one. It's 5 sessions where we talk about generational trauma that has happened for our community, for our Pacific Island communities, and getting that baseline down and teaching folks about the history, our own Pacific history. And from that, then we build into messages about your own health and taking care of your health. And then moving into sexual health. What does that mean to protect yourself? Because the problem is that a lot of things are just focused on, you know, use condoms, do this, do that, but we're not really addressing base issues. And so that's has been our first project that we've done with them, and they're looking to do further projects with us. And also doing the with our incarcerated community, it's just such a high percentage of Native Hawaiians and Pacific Islanders in there. So getting into there, doing testing, getting them signed up on MedQuest, that's been a big passion.
Okay, thanks a lot. Yeah, that's great information. So where could I find more information on that project? Is it something that's on your website or? Yep,
it's on our website, ihave.org, and it's under our prevention. There's a person named Jewel. Jewel is our staff person that does it. She is amazing at it. And if you want to get more information on that, I can send you her information.
Great, Peter. Thank you.
Yeah.
Okay, we had a question from Kat. Hold on. I'm trying
Sorry.
There we go.
Hi, sorry. Yeah. I'd like to learn more about how we can get walk-in STD clinics established on the Big Island, or more to the point, what are the obstacles for getting walk-in STD clinics established?
Kyle, do you think you could jump in with me? I'll explain a little bit, but it's always a matter of who's gonna pay for the service, right? And for the staff time and for the medication. So Department of Health does have they do have funding from the federal government to do that, but a lot of the agencies just have so many barriers up that it makes it very hard for someone just to walk in and get a test. And so, Kyle, I guess you can speak to that too.
Yeah, that's very true. The funding, of course, that's something that we're hoping to remedy with being able to bill insurances. We won't turn anybody away ever for not being insured or being underinsured, but that revenue generated will allow us to pay for those tests that the Department of Health may not cover. Also, just right now, we used to be a little bit more of a walk-in clinic at HIAF for people, but with COVID, we've just limited those hours, so it's appointment only. But we're working on the financial side of it to be able to offer that service in our Hilo and Kona offices.
I hope this isn't an unprofessional overshare, but I personally believe it is so crucial to be tested frequently throughout your adulthood if you are not in a monogamous relationship. And I realized, for example, my last testing, I then got a bill for $200 after I was tested with my insurance coverage. And I just thought, wait a minute, don't they want me to stay healthy? Isn't that in the benefit of my insurance company? So why is it so hard for this to be routine and frequent, and for this to just be common knowledge about your body and your state of being, so that you can be proactive and be safe for others as well? So just thank you for doing the work that you're doing and trying to overcome the obstacles that are in place for just like simple kind of, to me, common human rights, like it should be. But thank you.
We're just to add to that, something that we also do here is we do treatments. So if your test comes back positive for any number of the STIs, we can treat you here, and we are able to access the Department of Health medications for that. If you were to have an HIV positive test, you could just walk over right to my office and we could get you started on your meds that day. So we've really tried to take those barriers away, and we'll continue working on it.
I think more people need to know about that. So thank you for doing the work you're doing, and let our club know how we can help blast the good work you're doing around the island.
Yeah, agreed, 100%. We have a question from Charlene. I think you're still muted.
Oh, okay. So, hi, I'm Charlene. Are you involved with the coalitions on the island dealing with the inmate population and the juvenile diversion programs, including going home and, all the different coalitions on the island? Are you currently involved now?
We just had one of our staff people got hired at Going Home, so we do plan on doing a partnership with them. They've been expressed interest in working with us. We do some talks in the substance abuse programs, especially with the youth as well. And we are looking for every opportunity we can to get the word out about our organization and what we do for that population. So if you do know any key people that you'd like to share, I'd be glad to talk to them.
Because there are coalitions on island, and maybe Kyle, if you're involved already, it's just a plugging in. A lot of them need to be refreshed and strengthened. And I appreciate you mentioned that you got the, did you say Robert Woods Johnson grant? So
yes.
That should not only be focused only on Hawaiians, right? This is all people, all youth anyway. So anyway, I can provide that later. If you can just give the information, or Maurice, if I could get his email, because I wanted to give you our workshop for advanced healthcare directives as well.
Yes, absolutely. It's been shared in the chat already, but I will definitely make sure you get it.
Okay,
yeah,
sorry.
Not a problem. Keith Greer has a question. I'm unmuting you. Yep, there you go.
Perfect, thank you. So I saw that you were an advocate for Native LGBTQ rights, and having grown up on the mainland myself and being a member of the LGBTQ community, I'm not necessarily aware of some of the issues that Native members of my community might face. And I'm wondering if you can expand on that, on anything that is specific to them, or things that they're impacted in a way to a much greater degree than other members of the LGBTQ community.
Oh, that's a really good question. I definitely feel that across the board, there are so many issues and challenges that face this community. And with our those that are in the Native Hawaiian community, you know, there are just issues of generational trauma that are added on top of that. So it's coming from a place where not only were rights taken away for being gay or lesbian or mahu, but also your language was taken away and you were dispossessed of your land, you know. So there's huge connects that should be there that aren't there. And so it makes it even doubly hard for someone to put their own health first, right? So a lot of times with this community, it's always family comes first or my kids come first, and not placing the individual first. It's always the community first. And so it's just a matter of how we approach different communities. So I don't think it's like some people need more of this or more of that, but I think we have to be nimble and very creative as to how we approach everyone and every possible angle that we can come to them at. So if you're just doing like a condom campaign, like you got to wear condoms because condoms are important and you won't get HIV, a lot of times we miss the mark because people have competing needs or health issues or views about health that we just aren't addressing by just simply throwing an answer at someone. So it's a really complicated answer to what you said, but we definitely want to meet everybody in as many different ways that we can.
Great, thank you.
Sure.
Good questions. Does anyone else have a question before I fire off a few? Okay. Thank you, Peter, for being here, really, and Kyle. I think the work that you guys do is absolutely, you know, obviously obscenely needed. You know, we need more of you guys on the island. So, you know, thank you so much for offering this very necessary service to the community and to the underserved. Yeah, so I just had a couple questions. Well, one, you know, you were talking about the PrEP and the PEP. I had no idea that those drugs existed. That's amazing. How long have those been around?
The drugs themselves have been around for quite a long time, but it hasn't been approved by CDC for, I think it was approved maybe 5 years ago.
Wow.
Yeah, 6 years ago. And only recently have you been able to get them widely distributed and with they're very expensive. So not only do you have the issue of access, but you have the issue of insurance paying for them and things like that. But that's become much less of an issue these days. And all of our local pharmacies stock PrEP. And we've had a couple people since I started here about 5 weeks ago that have had exposure to HIV. And so we were able to quickly, within 72 hours, get them on PEP. So there are some really great community partners here with our pharmacies that we can call and say, hey, can you stock this for us? And they do. And so that's been really helpful.
That's fantastic. So I assume they're not generic yet. They're not generic versions, that they're still all patented.
No, but insurance will cover it. And then also our PrEP person can help you qualify for financial assistance through the actual drug company, and there'll be no cost to you.
So PEP and PrEP in other countries, is it still expensive, or is it similar to insulin where it's very cheap but expensive here?
These are branded drugs everywhere.
Okay.
There's some countries that get around that with their different patent laws, but not widely.
Okay. And what are the rates of HIV on our island compared to the other islands and perhaps the mainland?
HIV for our island, we estimate there is about 300 to 400 people living with HIV on the island, which is pretty low compared to the other islands. Oahu, we estimate about 3 3,000 to 3,500 people. So it is a lower incidence here. We estimate about a quarter of the people don't know that they have HIV. And we know once people find out that they have HIV, they stop passing it on to other people. So the new infections are really coming from the people that don't know they have HIV, and they have this high virus going throughout them, and they're passing it on to other people. Compared to the mainland, we are lower, much lower. Our hepatitis C, however, for our island, we have the highest rates, definitely.
Oh, wow.
Yeah. And so I get a lot of firemen that would come in that, would respond to a call, and they would get blood on them, and the person's like, oh, I'm hep C positive. So, running protocols with them. Same with police. So what we're trying to work on is getting hep C treatment done here as well.
Yeah, that's a major hurdle.
Yeah.
Oh, and then I had questions on your Syringe Exchange program. How long has that been in existence?
So the Syringe Exchange program in the state is one of the first in the country. It started in the 90s. And the legislature passed it and required an evaluation of it every year. So we have lots and lots of great data. We got the contract from Honolulu in 2006 to help them, because there's actually a van that goes around on the Hilo side, and they couldn't get somebody on the west side. And so we said, we'll actually be a fixed site where people can come in and get it. So that started about 2006, and it's grown really big.
What are the, was there a clear-cut statistic that illustrates its effectiveness?
Yes, it's with the evaluations that's done every year, it's very clear that it stops the transmission of HIV. Doesn't stop it, really, it lowers it significantly. So that's one of the reasons why our state is lower compared to other big cities, especially Honolulu compared to like Chicago or Jersey, where they jumped on very, very late in the game in doing syringe exchange. And so the pool of HIV in that community got really big. And as we know, it's not an isolated community. People come in and out of homelessness. People come in and out of the communities. You can have a mother that's addicted and the father doesn't know, and vice versa. And then it just starts to spread that way. So it's been really, really important that we started early in this.
Yeah, I think it's wonderful. I've seen numbers from other places. I know from going back to San Francisco, walking in my slippers, that I had to be careful where I stepped, because there's needles on the ground everywhere. I mean, just randomly. They're not all over the place, but just random places you wouldn't expect them. One day there's a needle, next day maybe there's not. But yeah, that's I think that's a wonderful service as well. So,
yeah, unfortunately, every now and then that someone might find a needle in the park. So I guess there was a needle in Bayfront, and so what happened was one of the mayor's people told the program that you can no longer do the syringe exchange in the parks anymore. And so it's kind of counterintuitive, because it stops actually those needles from falling in the parks, because we're taking them out of the park. So we actually had a big meeting that was supposed to happen in March, but COVID happened and that's all changed. But we're trying to get that message out there, like this is truly an effective intervention, because it happens all around us and we don't know.
So I have two more questions. One, roughly how many people per year do you serve? And also, how has COVID changed your business or your practice outside of having to do scheduling only?
That's a great question. I should have that answer for you, but I know that we serve about 250 people living with HIV. We do about about 800 tests a year. And with the amount of people that come from Syringe Exchange, that's, hundreds of people. And then on top of that, we have MedQuest program. And so we're helping, I would say it's about 1,000 people, right? With COVID, what we had to do was really to shut our doors. And that was the first phase of making sure that nobody's transmitting it to anyone. And really the first thing that came to mind was our Hep C clients and our HIV clients, was making sure they don't get infected or we put them at risk. Because every week we give them, they can come to inside for food pantry, they can get food, they can see their case manager if they need help with a bill, it was really easy. But now, we've been more loose on what's happened. We follow the governor's laws. I think it's open with care at this point, but it might go backwards. But it's funny. It really stopped our service, and then we've opened it up a little bit. And now that we've opened it up a little bit, we realize that not everybody was quarantining like they said they were quarantining. And so we're getting a lot of people coming in for STD tests. So we want to make sure that we have the proper protocols in place so that it doesn't keep spreading and we get people treated, get them what they need.
Well, that's awesome.
Yeah.
Thank you very much. I think we're at 1 o'clock right now, so that is going to conclude our meeting. Kat, if you would be so kind, since it's your first year, I think you have the 4-way test down, if you'll lead us in the test.
Sure. The 4-way test of the things we think, say, and do in Rotary. First,
Is it the truth?
is it truth? Second,
Fair to all
fair to
concerned.
all concerned. Third, will it build
goodwill and better
goodwill
friendship.
and better friendships? Fourth, is it
Beneficial
beneficial
to all
to
concerned.
concerned? And fifth,
Have fun.
fun!
Woo! Thank you so much, everyone, for making it and staying on with us. And Peter and Kyle, you guys have been wonderful in answering our questions. This video has been recorded. Our meeting has been recorded, and we will post it soon. I have to figure that out. If we can do that on our website or do links to YouTube, I think is probably what we'll end up doing. But yeah, those will be posted soon. But thank you all, everyone, for coming. Aloha.
Thank you, Peter. Aloha.
Thank you.
Thank you.